Naomi Oakes was a young girl who was diagnosed with acute myeloid leukemia. I heard her story through mutual friends, and I was particularly drawn to a video on her page of a woman sitting by her bedside singing her favorite song to her. The caption had mentioned something about how Naomi had a very hard week, and the music therapist helped her to fall asleep and calm her down from the high anxiety that she had been experiencing. I later learned that this was a form of music therapy. Today I will be speaking about music therapy, what it is, how does it help, and who does it help. To figure out the exact definition of music therapy, I turned to the Merriam-Webster dictionary, which told me music therapy is a treatment of disease by means of music. Well, what exactly does this mean, and how can music be a form of treatment? Music therapy has been known to help with a wide variety of things. According to Delilah Falcon, this type of therapy helps with physical, cognitive disabilities, emotional disorders, and social issues. A music therapist is considered a health professional because of the healing work they do with patients. So how does it work? According to Falcon, there are many ways in which music therapy can have a positive impact on an individual's health and wellness. The type of condition being treated determines how the therapy will work. Based on the specific patient's needs, the therapist will assess the situation and from there set up goals for the patient to reach. If the patient is suffering from an emotional illness, they will focus on some emotional development objectives. If the patient is recovering from a surgery, they may focus on developmental skills in the cognitive or motor area. The therapist will focus on their needs and pursue all they can in order to help that specific patient heal. Physicians and hospital staff report that patients who participate in musical therapy often require less medication to control pain and have better overall respiration, blood pressure, and heart rate, as opposed to patients who do not partake in music therapy. Music therapy combines the connection between music and mood. Upbeat music is often known to give people a burst of energy, while softer music is known to help people relax. Medical professionals took this into consideration and decided to use it in the hospital setting as a healing mechanism. The therapist often uses the music as a way to connect with the patient. This leads us to who does music therapy help? There is abundance of situations where music therapy can be applied. Because music therapy is a form of communication, this is a very good way to reach patients who have mental or physical disabilities that prevent them from communicating. It provides these patients a way to express themselves. Music has always been known to benefit patients who are introverts to come out of their shell a little more and be more outgoing. This also helps with patients who are autistic or schizophrenic. It helps them to break out of their shell as well. Music therapy has been very beneficial to patients who suffer from a stroke or neurological issues using a form of therapy called entrainment, which is the result of rhythmic music working along with the muscles and movements to relax the patient. Music therapy has also been effective with patients suffering from anxiety as it is used as a relaxation method. Depending on the situation, they will adjust it to the patient's needs. Over a vast amount of years, there have been many advancements medically as well as technologically. Combining the two and using our technological advancements to incorporate music therapy into the medical field has been known to be a success. Music has helped many patients suffering from all sorts of illnesses. Whether it be a mental illness, a physical disability, or a social disability, they have found a way to help. Music therapy is becoming a more common way in hospitals with treatments, and hopefully it will continue to change lives for years to come.